Supplements are great, but the issue that really plagues much of the supplement industry is twofold: quality and bioavailability. The higher the quality and the better the bioavailability, the better the results we can expect. Extensive research indicates that liposomal nutrients exhibit enhanced bioavailability, absorption, and efficacy. So we're going to dive into this subject and see how we can make the most of liposomal formulas moving forward. Our guest today is an accomplished pharmacist, a PhD scientist, researcher, and entrepreneur that's on a mission to make science and health accessible to all via cutting-edge liposomal products. This is the story of Biosomo with Dr. Matthias Wojcik. Matthias, great to see you again.
Hi.
We met not long ago in Baden-Baden. It was a beautiful time together. We had dinner together, and I can't wait to share your story. So thank you for coming on.
Thank you for having me. Thank you very much for the introduction. Yeah, hi.
No, it's you have this vast background with you're a pharmacist, this PhD in science researcher. But when I got to meet you, you're also just a lover of life. You're this guy that embraces kind of all experiences, and I kind of want to know how you got into this passion for something like supplements. What was it that brought you there?
So I'm coming from a tumor therapy or cancer research. So what we did there is like encapsulate mostly substances we want to bring into certain tissues, into direct places to have a local therapy for tumors or for cancer. And this is what makes me to get into introduced to liposomes. Because liposomes are very good carrier system for this type of drugs or substances. So this is what we developed through my PhD, or what I recognize we are introduced by a professor during my PhD. And then we thought a little bit of it, what we could do with this highly developed technology, what we are using in pharmaceutical compounds normally, to use them also for us, I would say even normal people, for everybody nearly. Yeah, so this is where like the connection is coming from. So now we are just applying liposomes in a certain, I believe, most advanced way, because we thought over many things, how we could introduce liposomes into supplements, how to use them, what makes them so good, and how to address and to interact with the physiological of our intestine and our whole body. So we wanted to use what is there, not like make crazy rocket science out of it. Just use what our body and nature gave us to make this thing happen.
Yeah, I find it really interesting how you're taking something that's already available out there. People have known of liposomes for a very long time. I do think it's quite marketable right now, and I'll go into that in a second and ask your opinion on that. But I did found it really intriguing how you're even combining it in different ways to improve the bioavailability, but also enhance it with things like lights and lasers, which we'll go into shortly as well. But getting back to this subject, like what are liposomes for the people that may not know, and why are they so popular right now?
So in a very simple way, it's a small fat drop. And fat drops and fat itself encapsulates fat lovely substances. So for our body, fat lovely substances, which are not water soluble, are normally not available because they are not dissolved. So our body is doing the same thing itself by bile salts, by bile acids, for example, in our stomach. And then they are released in the intestine, and then they are taken up because they are dissolved. So what we are doing now is like liposomes in a very technological advanced form, to make this thing happen and to support our body and our stomach to make the substances dissoluble and available for our body. So in a very simple way, it's like milk is a kind of a thing like an emulsion. So it's also like a fat droplets in a water compound, which make the substances which are fat lovely dissoluble. So milk is maybe a very easy example for liposomal formulations.
And it's basically, as I understand it, a great carrier of things into the cell, into the body. So you even look at something like phospholipid therapy, what they call the Patricia Cain protocol, which is basically using these different types of lipids, fats, to bring elements into and break through the cell membrane and enhance, again, bioavailability. Now, A lot of what people don't know is that when they swallow something like a supplement, very little actually gets absorbed. Is that correct?
Yeah, mostly it depends what substances you swallow and what you're taking. But in the end of the day, it's the intestine what is taking the substances up. So normally through the stomach, nothing is taken up. Yeah. So the most substances are taken up by the intestine. So and it's the first part of the intestine which takes it up. So for water soluble substances, maybe sometimes we have like for vitamin C transporters directly. So our body is like recognizing the substance and taking it up through transporters. So we have a certain concentration up then in your bloodstream. For fat lovely substances, we don't have any transporters. So what we have to use is this dissolving through oils or something like this. And then what we are trying is to attract the biggest part of the intestine because it's built up to have a very big surface area. So the surface area, the more surface area you cover, the better the uptake will be because the intestine has the possibility to take it up, yeah, in the bigger amount through this big surface area. And this is what liposomes are also interacting with, because liposomes are like very small structured vehicles and transporters. I measured them, for example, for our formulations in the university. They are around 100 to 600 nanometers. This is also the best size for being taken up in the intestine. And the other effect is that you increase the surface area by reducing the size of the fat droplets for uptake in a crazy big amount. So the higher, the smaller the substances, I would say even, or you can just take a powder, which you then just like make smaller, the particles make smaller, the surface area becomes even more bigger. So the bigger the surface area, the better the uptake through the intestine. And this is like what we are creating only there when we take only the intestine as one part. But the other thing is also what a supplement can do that good is when you swallow a capsule. You swallow it, it gets released. Maybe you build also liposomes up in the stomach and the intestine can take them up. But the surface area through a capsule is only like this small. And then it's also your stomach has to mix up the substances. So what we are trying to do is pre-formulate liposomes. So before you take them, formulate them for yourself. Because normally liposomes for a long time without stabilization are not that stable. Even in the small size. Yeah, in bigger sizes, no problem. So you have I would say like noodle water. You put on oils, you see the small fat droplets running around. They will after some time, they will just stick together and build a big fat droplet because energy wise, this maybe gets too much in physics, but energy wise, this is a very easy thing for them to do. And they like to be bigger than smaller because the energy, which is implied on a small structure, is much higher. So they want to release this energy and get bigger. Yeah. And this is what we are also creating. So when you have a pre-formulated liposomal formulation, normally they tend to increase in size. And then the uptake and also the surface area you will cover is not that high anymore.
I remember Dr. Christopher Shea talking about this as well, that not all liposomal formulas are the same. Many are just saying, let's throw fat at them, put them in there, shake them up, and that's kind of it, and call it liposomal and hope it delivers. But it's really creating larger pieces of liposomes or fats. Whereas I know with yours, Biosomo, because you showed me that very cool video where he put the liposomal formula within water,
curcumin.
shake it up, right? And it's very, curcumin is very, bright colored. And you see it almost automatically just shift throughout all of that water. And you see none of the fat particles. It's not like they group together in that water, but they just quickly disperse within that, creating an enormous amount of particles of curcumin within that water to be then absorbed and increase the surface area, correct?
Yeah, you're correct. So you normally don't increase you encapsulate the curcumin in the membranes of the liposomes. So this is what you do. There is like a double membrane created through the phospholipids we are using. And the phospholipids we are using are endogenous. So they are known by the body. So this is also why the uptake is that good. And the interaction between membranes is so good. So the uptake through the guts, through the intestine cells is higher. And then also you have like a securance of degradation of the substance which is inside the membrane. So the stomach acid cannot do anything about it. So you secure, first of all, the substance from degradation, and then you higher even the uptake. And then the second thing, maybe what I could add is also that by drinking, everybody of us knows nowadays all the formulas you can spray in your mouth, and you are attracting the mouth mucosa. And this is also a very fat, lovely tissue. So by drinking the liposomes, we believe that it's nearly like 15, maybe 20% even of the substances is attracted and absorbed by the mouth mucosa directly by drinking. And by swallowing a capsule, you don't use this uptake area and this pathways through for taking up substances into our body and into our bloodstream. So we are using really the whole physiologically, we are using our whole body, how nature gave it to us, to really try to make this substance available. And then I believe we will see much more substances which are natural compounds which can be used like this, because now you have purposes, you have big uptakes, you achieve bloodstream levels. You can maintain bloodstream levels. And this is a thing where I see very much potential in natural compounds when you take them like this.
Right. So you're basically saying that you're taking your product, the Biosomo. Let's take again the curcumin. We have other ones we could go into and talk about the line, but you're taking this and you're placing the liquid, the liposomal liquid itself, or curcumin that you created, the formulation, into water, mixing it that way so it spreads throughout the water, and ingesting it that way. And the benefit there, again, just to reiterate this and really nail it home, is that it's not just going to be better absorbed. It doesn't get degraded in the stomach acid. It goes into the intestines, coats the intestines more so you have more surface area, more absorption into the bloodstream of this product. But it's also about the mouth. And that's really interesting because I feel most people neglect that. In dentistry, it's not really a thing that you talk about, but in biological dentistry, it is. The oral microbiome, absorption within the mouth, blood-brain barrier right there, all these things are a big point of it. So can you go into that just a little bit more so we can really nail down the importance of why you want to start the absorption within the mouth?
So to make it very simple, you just use another compartment to have an uptake. So we can also say, for example, maybe we just covered all the surface area of our formulation by our liquid, and then still liquid is inside our intestine, which is not covering nothing. So this liquid isn't taken up. So we just reduce the amount we could get into our body by not attracting all compartments which are able to take up substances. This is the same thing when I just interact with a different pathway. Yeah, for example, with vitamin C. Let's take it as a water-soluble substance for liposomes. Vitamin C has its transporters, but when the transporters are filled up, the amount of vitamin C which is then taken up into our body is very limited. So it's not a normal gradient, which is like going up higher, and higher. It's like a curve. So there is a point where the uptake, even if you take more vitamin C by oral administration, is not higher in the same amount you take vitamin C compared to the oral administration. So what we are doing then with liposomes, for example, we are using the fat transportation system, which are then attracted by the liposomes, to use a certain to use a second pathway, not the vitamin C transporters, but the fat transporters, to adjust more vitamin C in our bloodstream. And this is the same thing with the mouth. We just use a different added compartment to even higher the bioavailability even more than it would be anyways.
It's becoming more efficient what the body already has, right?
Totally, yeah.
It's the fact we miss so much, especially as Americans, that we don't chew. We don't use saliva to begin the digestion process. And we don't even allow the mucosa to really thrive. We feed it poor things, sugary things that aren't going to help our microbiome in our mouth become a healthy version of itself. Now, when you go into, we've spoken about curcumin. That's an obvious one as far as just the color of it, and we could go into the benefits. But what other formulations, what other ingredients are you utilizing within Biosomo?
So normally you can just use for transportation with liposomes. The best things are, like I said, it's like fat lovely substances. So for example, Boswellia serrata, frankincense is a very good anti-inflammatory, reducing pain, directly interacting with our cyclooxygenase system. So it's like the pain relief system, which we are like directly blocking. So normally you just really use fat lovely substances. You can use all the fat lovely vitamins, A, E, D, and K, for example. You can use astaxanthin, resveratrol, quercetin, saltstramsins like this. But there are also possibilities to use liposomes, like explained with the example of vitamin C, to use fat water lovely substances. For example, what I could think about are the B vitamins. So they are like water lovely. And normally you just apply them even through intravenous administration. And then they are just taken out immediately what your body cannot take up. So you just want to create like a second pathway or like a depot, which are liposomes also creating, because they are encapsulating the substances. The substance is not directly recognized by our body. So it's like circulating longer in our bloodstream, for example, in liposomes. And then we have a maintenance of blood levels for a longer time than we would have only through administering these vitamins. So there are different uses how you would use liposomes. For fat lovely substances, to dissolving them. For water lovely substances, mostly to attract different pathways or to create depots to have a longer maintenance.
Yeah. It's one of those things that you're taking all these ingredients and you're basically making them supercharged in a way of how they're going to get into the body and create a reaction. And so much of that, as you mentioned, is an anti-inflammatory, right? You're trying to reduce inflammation throughout the body, which is an initiating point of so many diseases. It's the vicious cycle of what's causing inflammation that causes more, that continues on the cycle and then degrades basically the cells around that. Is that the main thing that you would say that you're trying to do, is reduce inflammation and just increase the bioavailability of how the cells are going to utilize the nutrients?
For the most substances, it's about a medical purpose. But there are also substances we can use, like, for example, what we are created in the beginning directly is alpha lipoic acid. It's I would say not like in a typical medical way to use the substances, because it's a catalyzer for the ATP production in our mitochondria. So what we are trying to do is to use it, for example, in muscle recovery or endurance training. So what we see there is that our normal persons, like we are probably, we are not able to create, due to the fact that we are catalyzing by alpha lipoic acid so much ATP production to develop muscle sore. It's not nearly impossible for us. Because muscle sore depends on the ATP values and the possibilities we have in our body to create energy out of our muscles. And once this energy is depleted, we create this muscle sore, because then the acidity in our muscle starts to create. And when you have the possibility to catalyze production of ATP through three different pathways, then you have so much ATP possibility of production that there is no possibility, that it's like nearly no availability. It's like very good available for our body, the ATP production. Then it's catalyzed so much that the muscle sore, it's not coming. And this is what we saw. This is what I'm very much into. Is for me, it has everything to be like, because I'm educated out of university, it has to be science-based. So what we did through this alpha lipoic acid, we did like 2 patient studies with the sport school in Cologne is a very, very famous one in Europe. And they saw through different endurance training that this effect is really happening. And we even had to check it by our doping agency if this is not for athletes so much pushing endurance and energy levels and even making them compared to others so much better by taking a substance that could be even considered as doping.
Create ATP, take care of the mitochondria. You have tons of energy to do what you need to recover, to do everything. The body functions better, right?
Yeah.
You went into the research on healthy athletes. Is there any research or evidence on, let's say, ill people that this is helping them to recover?
So for curcumin, there are many uses. So for anti-inflammation, for example, for degradation of cells, it's like very good agent to find degradative cells and to bring them into apoptosis again. So you just help your system finding the cells which are abnormal and to just reduce the amount of the cells. And there are many studies done. And we did also one thing. We did a cellular study for our intestine cells to see and to compare the uptake of like pure curcumin compared to our liposomal formulation. And we are now doing it a little bit further and comparing it even to micellar formulations. So we see like directly the influence of different types of vehicles for our intestine cells. And what we measured is 110-fold higher uptake by liposomes than compared to pure curcumin. By only 75 milligrams of curcumin given.
Well, that's the thing. You're using less and getting more. And that's exactly what the body's about. That's exactly what most people in medicine get wrong. They think more is better. And that's not necessarily true. Again, you could have a lot more vitamin C. If it's not being absorbed by the body, it doesn't matter. It really, you could throw all the milligrams you want at the body. If it's not being absorbed, it's just waste. It's just actually taking energy away from your body, trying to process it when it can't.
Totally right. Totally
right. And that's what people get wrong. Sometimes they think all supplements must work. That is absolutely not true. Sometimes they're counterproductive to what you're trying to do. And a lot of supplements maybe even know that, but just market it well.
Yeah, I give it. Yeah, this is the point. I see also that sometimes substances even can, from a perspective, be a toxicity to your body when they are not dissolved anymore and where they are not dissoluble and they are not like bringing you to a healthier spot. It's like they're making totally the opposite because the formulation is not right and your body cannot interact with them. And then also the concentration of the, I would say, substance which is not dissolved in your intestine grows higher. Maybe your liver cannot handle the elimination of the substances then anymore. And this is where I believe also due to hiring the amount of substances we give. Yeah, we have now with curcumin the thing in Europe that we have to point out that we could have liver toxicity and for example, or bile toxicity or toxicity in our body because the substance itself is like higher to a so big amount to make it somehow work.
Yeah.
It's even not working good, but it's somehow only to work to sell it that you just make the opposite you wanted in the beginning.
And I've seen that before, Matthias, where people, even patients of ours, have gone out and tried other herbal remedies, let's say themselves, and just taken massive amounts and had acute toxicity, and their liver basically almost failed because of it. You don't realize just because it's natural doesn't mean it's only going to give you the good. Every element has a good and a bad to it. And too much of anything could be absolutely bad. And that's, again, where people take this maxim that more is better. And it's not. It's really the quality and the absorption. How little can you get in to make the most? And that's where the body loves it. It's becoming very efficient. Don't throw a lot at it. Throw a little in a way that it knows how to process, and it's going to work better. And you even took it a step further, which I thought was very cool. You did this by Biosomo, but you connected. I met you through Robert Weber of Weber Medical, who's a laser company, basically, first and foremost, light and laser. So, I was like, okay, he's bringing on a supplement guy. Where's the synergy in that? But there's a huge synergy in it. So can you explain how you connected with Weber Medical and why you did that as a liposomal supplement company?
So this also originates from our cancer research, because in cancer, we are using substances. We are bringing with liposomes to different compartments. And then we are trying to activate the substance to destroy the tumor cells locally. And this is where we are having the connection between each other. We are using certain substances which can be activated by certain light lengths and then directly produce reactive oxygen species. And this reactive oxygen species drives cells to necrosis or to apoptosis. So you can locally, when you can saturate up a certain tissue with a substance, destroy the tissue there. Yeah, it doesn't depend if there's a good tissue or a bad tissue. That's why it's very crucial to have a very specific targeting of different types of cells or different types of tissues. But then you have a very localized therapy for certain, for example, cancers or tumor types and everything without any negative side effects, because light and also the substance itself, there is no counter mechanism for a tumor against it. It's not like an efflux pump which will put out the substance, or the tumor is not reactive to a certain monoclonal antibody or something like this. It's like nearly it has no counter reaction, or it has no possibility for a tumor to not be activated or be harmed by this type of substance. So this is where we're coming from. And now what we are seeing is we're using this in different types of, I would say, therapies. For example, we did a certain study in Kenya where we tried to cure, or I would say to help people with malaria. Yeah. So we applied a vitamin B2 complex, which is then activated by blue light. And this light could clear out the parasites out of the bloodstream. Yeah, I know people will tell you parasites are also in fat-lovely tissue, but in the end of the day, normal therapies only are curing them out of the bloodstream, and the measurement is the bloodstream parasite value and not the fat tissue, because I cannot measure in fat tissue. So, but we had very good results out of it. And nowadays we are using light therapy combined with supplements, because red light has also another possibility of interacting with substances. For the first thing is red light activates the metabolism of cells. So when you apply red light onto cells over a hand ref with the endolight laser watch, or maybe you do photobiomodulation like intravenously, what you can also do with the laser system, you have an activation of metabolism. This drives substances direct into the cell, because the cell is metabolized and activated more. And then otherwise also red light is creating certain holes in the membrane. So surrounded substances, when the dissolving and the blood levels of certain substances are high enough, you achieve even a higher uptake. So this is like adding. You don't need the synergy, or this adding of different types. But when you have it, you just boost your therapy even higher than it is anyways. But only when you really have substances which are available in the bloodstream. So it's not that for a normal curcumin, it does nothing, because curcumin won't be taken up into our bloodstream and it's not there. So light therapy won't make a substance which is not available for our body be available. It only makes a substance which is available be even better. That's the adding.
Is this what you see as the future of supplementation? Because it sounds pretty cool that you could take a liquid, your Biosomo, you could drink that and understand that there's billions of these particles of curcumin, whatever it may be, vitamin B, D. And then you could wear a watch with lasers on it, like the endo laser that is penetrating through the skin into the radial arteries, into the veins, and stimulating. So you have this compound circulating, then being photodynamized to be even more bioavailable. Is that how you see the future of supplementation? Like people literally doing that, strapping this watch on and just getting incredible efficacy from their supplements?
I think this is the way we should promote, and where we should work on. Yeah. This is
to take that even a step further, Matthias. Do you see it where certain areas you could shine laser on to stimulate? Would that increase the absorption of a certain thing to go to a certain area? Because I know a lot of times you're talking about systemic reactions, where a lot of times you want something to go somewhere. I know my father is always trying to do this. I know I could pump things into the body. How do I get it to really go into the brain, to liver, into these areas, stimulate it there? And do you see it as possibly light can be that bridging that guides things to a certain area, or are we still not there yet and it's still very systemic?
So we are on the path to this research. What I know that I read even publications where you could interact with certain tissues with light and, for example, drive stem cells there.
Yes.
Yeah, because the tissue is activated in a certain space. We are not understanding it fully. What is happening, or if there are like enzymes released by the cells or by the tissue, which are attracting then stem cells directly to this compartment. But what we see is that there is some attraction. And what we also see is that certain types of tissue attract cells which are also in a certain type much better than others. Yeah. So for example, we did once a research with circulating tumor cells. We are just clumped them to a circle on a plate and then put stem cells next to them. And even without irradiation, the stem cells were attracted by this tumor environment. We don't know directly why. What for pathways were activating, for enzymes or molecules were released to attract this type of cells. But I believe it could be a possibility to, in future, to have a certain cell type or a certain therapy which will attract substances to go there and to interact with this certain tissue specifically.
That's incredibly cool if you think about it.
Yeah. But in a much higher value, then they will interact with other tissue.
And anecdotally, we've seen it at the clinic utilizing things like concentrated PRP, V cells, stem cells as well, and utilizing laser light in certain areas to really stimulate that and get a reaction. Because, of course, stem cells are there to repair. V cells and PRP are also somewhat of a guidance system, telling where to go and seeing where repair is needed. And then finally, the stimulation of certain light can also not just increase blood flow and oxygenation, but kind of act as a signal to the body. Everything is information. Let's put it that way. How you break it down and how your body uses it. So if you could utilize light within highly bioavailable substances that are also signaling different repairs and different things, then that seems like you're not being wasteful anymore. You're not just pumping the body full and hoping it goes to the parts it needs to. Of course, the body is smart, but it's a lot is lost too. Sometimes we could help with that efficiency. So, I mean, talk about like the implications of that, like even things like repair of knees or joints and ligaments and certain things. Like, have you been looking at that, of utilizing Biosomo with light onto, let's say, the knee for anti-inflammation, everything else?
So this is like, we are not like so long on the market now. This is a very new product. So we are like, now out for, I believe, only 3 months. Yeah, because it took a little bit of development and transferring the technology to the compounds we have now. And then I believe through some experience and time, we will see this and also have better, I would say, standard operation procedures. We will see what for amounts and the dosing directly, how long we should apply energy over a certain time, because energy or light is nothing else than energy per square centimeter, which we are applying on a certain surface. And this is also a thing, which penetration depths we need.
Right.
If we have benefits by combining different light lengths, if what for light lengths directly we need, which insights are there. Even we could also think about maybe someday targeting the blood, targeting the brain with substances, to achieve a substance which is able to cross the blood-brain barrier, or to maybe interact with the blood-brain barrier with light in a certain space, then to interact with other substances. This is, but I believe we are in the beginning, and we just have to take step by step, and then
Well, it's an exciting future. Yeah, it's a very exciting future.
I believe, in my opinion, we are on the right path.
I do too. And I've always found, I mean, I've always spoken to my father about this of how do we get things to go to certain places, enhance the absorption there, really get it to be delivered, enhance bioavailability. These are the secrets we need to unlock to truly start to, I think, reverse disease in this much simpler way than all the procedures and heavy drugs we're using right now in modern medicine. And things like you said, the brain, transcranial photobiomodulation is an amazing thing. Then you add in the right elements around it that synergize it and really impact the brain and absorb it through there. And you could do so much to really help the brain, which is such an important organ within the body. When you look at the line of Biosomo, can you go over like what are the key critical kind of top products there? And do you have any kind of notion to expand shortly, or is it right now just on these and focus on this line as it is?
So what we have now is directly, we have like ECGC as a green tea extract. It's very good for cardiological diseases, or I would say for your cardiological health in total. Then we have boswellia acid. Yeah, so frankincense and curcumin for the anti-inflammatory side of where we are want to have like our impact on. And then we are using alpha-lipoic acid, as I said to you. Then what we are now trying to build up is a anti-oxygenatic drug like astaxanthin or resveratrol, maybe, for example. Quercetin is a very interesting thing. But this is a development type of question sometimes, because we have to get, first of all, agents, then they have to be in a certain purification, because we cannot use every extract, because then the liposomes are filled up by, I would say, substances we don't like to have in our hiring of bioavailability purpose. Then, this is, I think, what we now developed, and where we are building up a certain amount now is the fat lovely vitamins. And there we also had done with a certain company a patient study where we see like the hiring of uptake indirectly in real patients, not only on cells. Then vitamin C is a very, I would say, interesting compartment due to acting and interacting with different pathways, like I talked in the beginning of. Maybe the B vitamins. What I'm not very into is like combining all of the substances in one liposomes, because you don't know how much size they fill up in the liposomes. And for curcumin, for example, the phospholipid amount which creates the liposomes and the curcumin amount are calculated. So we know for sure by molecular masses that all the curcumin we put into this agent, after shaking it with a certain amount of water, is really encapsulated. We don't want to have curcumin which is free lying around there, because then again, the toxicity by the liver, sometimes elimination and problems you have, and then you don't have any uptake by the curcumin which is not encapsulated in liposomes. So that's why we are like trying to make substances as pure as they are in a certain way, or only use one substance in a liposomal formulation and not like combine 10 substances in one liposome.
Well, that's the thing about supplementation and formulation. It is an art form. And I think many forget that, and some come into the marketplace and just say, let's grab whatever's trending, throw it in a capsule, get it as cheap as possible, and put a lot of marketing to it. And let's take these, top ones, whatever it is, the flavor of the month, and add it with this and do this. And it doesn't work that way. You can't just do it that way. It has to start with quality, number one. It has to start with some synergy. It's like, I will said, this is like cooking a very good meal. It's not that more ingredients and things go together well. Sometimes it tastes like shit. It's like, totally you can't just throw everything together because it's cool. Oh, let's do collagen with this Wagyu steak and all this. Like, no, that's not how it works.
What I also see is that many of our agents we are using, when we are using them right, and they are available for our body, they are multifunctional. So what we are doing with natural compound, that's why I like very much natural compounds, even due to the fact that I'm educated, school-wise, very pharmaceutical. Yeah, I like this natural compounds because they are doing many things to help and to do good things in an easy way, not to go very into detail in our body. Like a normal pharmaceutical compound, its purpose is to lower one value. I see on the blood levels, okay, this value I want to lower, I give this compound. Then the other value goes higher, then I give this compound. And they have no purpose besides lowering a certain value. A curcumin, you cannot tell a curcumin, don't do this thing, don't do this thing. It will always do the good things and the multifunctional approach it has. So it will also be securing neurological cells. It will also help to find degradative cells. It will always, stop inflammation and bind direct to enzymes of NF-kappa B, for example. So this is the multifunctional approach. When you use the substances right, sometimes you don't need this mixture of different things. You need this mixture to make people realize and believe, oh, look, they can do everything. But itself, there are so many substances which have this multifunctional use when they are used right. And I believe through liposomes and through good formulations, you can make them really be this multifunctional agent for the first time.
Totally. Nature has all the answers, and we have to remember we're part of nature. So when we combine natural elements with our own nature, we know what to do with it. Our bodies and nature is smart enough to work and start to heal us and optimize our health. Matthias, where can people learn more about you? And I know you're trying to get this into the United States. Is it available to people right now to try within the United States?
So this is what I also I'm very happy about. So I got the FDA registration of my facility. Everything
Congrats.
is done. I've got the labeling done. So it wasn't really that tough one. It's just a little bit, it's much paperwork. And I would say you just need from a European side, alternative wishes in the US and knows all the regulations. And then it's done. And then it's like always an investment thing. You're willing to invest. You're willing really to have a certain, like I said, investment done to make this happen or not. If you are not, then sometimes you know, FDA is not like willing to interact with you and to help you in these things. But in the end of the day, it's not a very, very hard thing to do. Yeah. So this is done and the labeling is done. So we are set to ship everything we have in stock, and every substance we are having, and every substance is also like checked by the authority. So it has no problem with the US market. Yeah. So shipment is ready. Where people can inform themselves is on my homepage. So it's www.biosomo.com. So you can look everything up, our substances. We are like editing everything. We are getting news out, which new substances are available. And also for sure by all the distributors we have in the US, I think you have also some insights now. So I believe we will interact together, I hope.
Oh, for sure. I love this stuff. I love everything about just cutting edge. I mean, it's always been for me, how do we continue to push the boundaries of medicine? And what medicine is optimizing health. That's my definition of medicine. How do we continuously optimize health, and how do we continuously push the boundaries of how we heal and do that and optimize our well-being? So thank you for your contribution to that, Matthias. And thank you for coming on.
For having me again.
Enjoy Las Vegas. I know you'll be at A4M. Wish I could be there with you, but hopefully you'll get some doctors on board with this and start to change, the approach and give them something that really is effective and can help a lot of people.
It was an honor to be on your podcast, Caspar. It was a very, very nice time with you, and thank you again. Thank you.
Yeah, thank you. And we'll be connecting soon, I'm sure. So go ahead and check out Biosomo. That's biosomo.com for more information. And until next time, continue writing your own healing story.